Assalamualaikum everyone, this is me Dr. Saira. I'm working as assistant professor in Department of Pharmacy Practice. First of all, I would like to thank the entire team of Biological Risk Management Conference for giving me this opportunity to talk on the topic of greatest concern of the time, the COVID-19. So I will be talking on the potential threats of COVID-19, different strategies to mitigate and the impacts of COVID-19 and what are the different controlling measures that we have came across during this project. So the coronavirus disease, COVID-19, it started in late 2019 from China, and now it has become a global concern. WHO has declared it as a worldwide pandemic, and it has affected almost 114 countries and killed thousands of people. These coronaviruses are the large family of viruses which can cause different illnesses from a mild common cold to severe diseases like Middle East respiratory syndrome, SARS viruses, and the novel coronavirus. Um, Depending on the patient's condition and at the different individual levels, the clinical features are 1 to 27 days of incubation, and it can take around 3 weeks to 6 weeks as a recovery period. Following are the symptoms of COVID-19 infection, which has been reported most frequently, like fever, cough, myalgia, shortness of breath, and less commonly addressed issues are like sore throats, headaches, cough with sputum production. So basically, this was an extensive project which has covered each aspects of COVID-19 and its impact on at individual level. So the potential threats was also a part of this project. So we have actually conducted a study. It was a survey-based study and included every individual, those who were suffering from COVID-19, the current positive cases were of COVID-19, individual without any symptoms of COVID-19, who has suffered in the past, to evaluate the most commonly came across issues of COVID-19, what were the different impact or factor of COVID-19, and individual without any symptoms and negative history of COVID-19. So it took around 11 months to complete the study. So the finding as part of the potential threats were the basic social distancing issues, the lockdown, the restriction from the social lives, different myths, and in following the preventive measures were also involved in this project. So we have came across the issue of over prescribing, extensive prescribing as part of self medication, the excessive use of medication, the infection and perceived risk of deaths from this COVID-19, the negative mental health as part of the quarantine, and maybe restriction from the social life, social circle. It was affecting the individuals at different level of anxiety, depressions, and mental disorders, mood disorders, and around 10.7% of population was concerned about the unapproved vaccination available at that time. Since the DRAP has not approved the vaccination, so it was also the part of this concern. Um, Along with all the threats thrown by the COVID-19, the healthcare services and access to the healthcare services was also the biggest issue at that time during the first and the second layer of COVID-19. The hospitals and different healthcare facilities lacked the facilities to care the patient, to provide the patient with moderate care, moderate health. So 35.4% issues were addressed as part of the unavailability of treatment for mild symptom patient who were at early stages of COVID-19, or maybe the patient with less severe symptoms were not given the attention of that level as it was assessed. So 45.2% of the response were in about the fear to catch the infections, and they were not confident in going to healthcare systems and to get their treatment. 52.3% issues were addressed as part of the self-medication from the different community setups, from the different pharmacies. 52.3% patients and individual were taking medications as part of self-medication without any prescription, as preventive measures, self-treatment, immune boosters, maybe multivitamins, and even few of the supplements were also included in the self-medication. 34.2% participant responded to afraid of getting treated with unapproved medication, since WHO has not approved any vaccination during the early period of time. So 34.2% individuals were concerned with the unapproved treatments as a part of clinical trial, so they refused to access the healthcare system. 23.4% of the healthcare system lacked all those necessary equipments and facilities, available beds, available spaces for quarantine of the patient, for providing the patient with adequate level of healthcare. 28.6% of actually COVID-19 positive cases decided to better stay at home when they were asked about to not going towards the healthcare centers and not trusting the healthcare centers, as they have addressed this issue of not going towards the healthcare system and better staying at home in case of unavailability of the facilities. Sometimes the likenesses of the few equipments in the facility and unapproved treatments. So as part of all of that, as a collective measures, 27.3% patients responded to unavailability of the oxygen cylinder, the basic issue that was reported majorly during this phase. So the deaths in hospitals, and according to the responses of the patients, they prefer to stay at home in their critical stages. The self-medication was also the biggest concern, and we tried to evaluate the reasons towards the self-medication with the positive history of COVID-19 patients, and also the patient who wanted to prevent the infection. So acetaminophen, ibuprofen, azithromycins, hydroxychloroquine, penicillins, and different antiviral drugs, and different types of supplements, and vitamin C was also the major supplement among all the other supplements. So they were using it for fever, cough and cold symptoms. Few patients were self-medicating themselves in case of their PCR positive. Severity and prevention, and COVID-19 symptom relief. So the different strategies to mitigate the impact of COVID-19 was concluded that it is very important to take initiative in education and in healthcare system, in betterment of healthcare system. The appropriate healthcare services throughout the country is required to instigate as part of healthcare personnel. Every healthcare personnel and every healthcare expert is responsible to enhance their own professionalism and reducing the inappropriate prescribing practices, the irrelevant prescribing practices. So this can also plays a part. In response to the COVID-19, the continuous services that are encouraged for the greater collaboration between different healthcare professionals, and the different health and the research organizations should initiate this motive to evaluate different factors which are the biggest concern of the time, and to try to resolve those issues at every institute level. The media, which is basic collaborative agent between the patients, the individuals, and the research organizations and the healthcare organizations. So it can also play a vital role by controlling such factors in educating the people. Check to see what the national, regional, and the local authorities are advising, and the different preventive measures should be followed as which are relevant to preventive strategies of COVID-19. These are the references. Thank you very much.